must be able to manage COVID-19 as it will be with us for a long time. That's the word from Prime Minister Dr. Hubert Minnis, who this week said in Parliament that getting to zero cases is unattainable, which means we must find a new normal. Welcome to On the Record. I'm your host, Jerome Sawyer. Around the world, countries continue to struggle to get to a state of normalcy. On tonight's episode of On the Record, managing COVID. Stay with us. Our program continues right after this quick break.
So the project really pays itself.
Correct.
They set up
at the conference, more the school.
As a journalist, I always have to focus on the facts, and sometimes that means going to investigate for myself. On the Record, Thursdays at 8 p.m. right here on RTV.
Welcome back. You're watching On the Record. Tonight, we cover managing COVID. I'm your host, Jerome Sawyer. With such a highly contagious virus like COVID-19, epidemiology, contact tracing, and patient care during the time of illness for COVID patients are some of the most critical aspects of managing this virus. In the case of our next guest, he's responsible for conducting testing for those who are unable to leave their homes and provide care while they are critically ill. My guest for this portion of the show is Dr. Charlo Bain. Dr. Bain, welcome to On the Record. Thank you so much for agreeing to be on with us this evening as we certainly delve into what's been, I think, one of the longest ongoing topics for us on this show. But let's talk about the work you do with COVID mobile testing and what all does that entail?
Thank you again for having me. So I am a part of the mobile unit, which is responsible for conducting testing for those persons who have identified as being suspected cases, as well as assisting with testing efforts to recover those individuals who would need an objective negative result prior to gaining medical clearance. And so I work in hand with the contact tracing unit in terms of identifying those individuals and then facilitating the testing efforts.
Now, how does that work? How do you determine who is immobile, who is not able to get to the facility? How do you qualify? How does one qualify for the mobile testing?
So that information is, as I mentioned before, we work hand in hand with the contact tracing unit. Those individuals would receive a listing of those persons who have been identified as positive. They also inform us if those positive individuals, if these individuals are currently in quarantine, if they're individuals who are also symptomatic in the home or residence who would also need to be tested. They would also inform us as it relates to how long these individuals have been in quarantine. Have they completed a portion of isolation where they're now eligible to be retested? And also, as well as informing us of their results to see whether or not they actually require another test in order to gain medical clearance.
Now, I have to ask you about the risk factor because you're walking into the unknown, and in many instances, you're going into people's homes or where they're being isolated or quarantined. What is that like? And is it any different with having to test somebody who's coming into a medical facility?
I would say yes, there's a stark difference. It's very humbling because you understand that the perception of it is that no one wants the attention of having to be tested, even though they have the comfort of being tested at home. And so my unit, we try our best to be both as accommodating and as discreet as we possibly can be. We make sure that we call ahead to persons so that they are available when we arrive. Prior to actually going to facilitate the testing, we call ahead and we also make sure that we confirm the directions as well. And at that point in time, if the individual asks if we can do it at a more discreet location at the home or if the person is not available at that time, we will see how best we can facilitate another testing effort. But once we've identified the person and we've confirmed the directions, we've arrived, like I mentioned, we try to be as discreet as we can. So we would not be going into the home without our protective equipment. We would make sure that we would don that, however, as close as we can to the point of entry, so as not to draw any unnecessary attention to the procedure that we're actually about to perform. As it relates to the procedure, once we're in the home, we make sure that all the individuals that are present are aware of what we would need to test as it relates to giving us a significant amount of space from the person who's going to be tested, as well as informing them, giving them education rather, as to what needs to happen following the test as it relates to persons quarantine and what they need to do to be responsible in that process.
And part of that question too, is it a great difference from being in a medical facility? Because I would think in a medical facility, you take the sample is immediately put somewhere where it's stored, it's safe. But if you're mobile, then conditions are a little different.
Conditions are a little different. You don't have the luxury of having one central storage unit, and so we would be actually traveling with a cooler that would allow us to have safe transport of the medium, as well as the proper equipment to store whilst it's in the cooler as well, because we want to make sure that the samples are not compromised before they actually get to a testing facility. And so in terms of that portion of it, yes, I can agree that there is a difference.
Have you had any instances where samples have been compromised?
Not in my experience, no, sir. But I can imagine where where it possibly can happen in the chain of transport, whether it be coming from the family island or simply coming from a member of my team to the testing site. There are so many things that need to be taken into account as it relates to making sure the sample is properly screwed on, as to making sure that the sample is properly labeled at that time too. And so we take great care to ensure that the sample that we take is treated with the utmost importance.
Having gone through this several times, I know what is involved in terms of the actual sample and being aerosolized and being in contact. Do you ever are you concerned for your safety, or is that something you sort of gotten over having done this so many times? I mean, is there still a fear factor after all of this time?
I would be lying to you if I said there isn't any element of fear in doing so. Of course, in it becoming more frequent and it becoming more consistent, you become more understanding, because you realize that if you're fearful, it's difficult to perform your job, and someone that is already fearful, having the test facilitated, even though if it's in the comfort of their own home. But the reassurance is there with the fact that I have my protective equipment, and also with the fact that ensuring that prior to the procedure, I'm explaining everything that needs to be done prior to. I'm also ensuring that all of my colleagues who are with me during the testing are also aware of what needs to be done so that everybody remains safe. But as you go into the various homes, you realize that the virus is not the only thing that persons are suffering from. Some individuals are asthmatic, some individuals are suffering from hypertension and diabetes as well. And so whereas we're facilitating the test, there are also several other things to take into consideration. The symptoms that we may exhibit, can be, for someone who's not well versed in going out into the community, a little shocking, and definitely can make them fearful. But like I said, the reassurance is that once you have your proper protective equipment donned, and that everybody is aware of the procedure and the precautions, that everyone is safe.
I want to shift the conversation a little bit to symptoms now. For those patients whose conditions are worsening, what are some of the symptoms that you find that they most commonly present with?
So one of the most common symptoms that presents, and one of the biggest ones of concern for us, are those respiratory symptoms. Some individuals start off initially with simply a dry cough, which then eventually worsens into shortness of breath, which then also worsens further to where this individual no longer is able to speak in full sentences. Their breathing becomes really rapid and erratic. And at that point in time, we know that they definitely need some treatment at a medical facility in order to combat the infection that they're currently fighting. Also with that too, there comes the understanding and the knowledge of how the virus works, to understand that the respiratory conditions that we've kind of been acclimatized to expect may not be the worst that can happen. Some individuals may have chest pain, so we understand that we also need to be cognizant of whether or not there's any cardiovascular or heart complications that can be developing, if there's any swelling of the limbs, to see whether or not a blood clot could have possibly formed as well. So when we think about symptoms, of course, we always listen out to see whether or not they're in any respiratory compromise, but we check to see that there's also nothing else going on as well.
And considering there is no cure at this point, how do you treat these symptoms? And I guess it's almost like the flu, where you have to hone in on what people are feeling and what they're experiencing. But how do you usually treat the symptoms and the more common symptoms?
Well, the more common symptoms, those that belong to the flu, as it relates to the fever, we would instruct persons that there are several over-the-counter medications that they can take to reduce the fever, Panadol being one of them. As it relates to cough, as it relates to having any issues with replacing water, or if they need to be rehydrated, educating them on, if they've had episodes of diarrhea and they're able to keep food down, that Gatorade with its electrolytes can be beneficial. As it relates to even assisting them with which over-the-counter medications would be best for them. As you may or may not know, everybody responds to different over-the-counter medications differently. Some persons can use Histal, other persons have more of a better response to bisolvent. And so just being able to provide them with those options if the need arises, that goes a long way.
Now, one of the things that you hear as a COVID patient, as a COVID survivor, is you need to get your immune system back up. But even for people who have not been infected, how important is that regimen of vitamins and general good health? Even if you have not been infected, but certainly if you are infected and going through all of this, that is it important, or how important is that regimen of vitamins and those things that can boost your immune system?
I feel it's very important because at the end of the day, this is something that should have been commonplace prior to the pandemic. Making sure that your immune system is as strong as it possibly can be, because COVID is not the only infection that you can possibly contract, or you're actually susceptible to. And so ensuring that you have a vitamin regime, whether or not you're taking a multivitamin, whether or not you understand the importance of taking vitamin C on a consistent basis, also does well, because at the end of the day, when I come to patients, they ask me what's the difference between them and myself. Really and truly, it's the immune system at the end of the day, outside of any chronic conditions that they may have.
Something you mentioned, I wanted to go back to. You said, you are susceptible to other infections. If we could talk a little bit about that, and what are some of the things that that you can be susceptible to as a COVID sufferer?
And so if you have active COVID-19 infection, then the understanding is that what we call immunocompromised. So that means that your immune system is not functioning at 100%. And so the likelihood of developing any other illness is then greater. Any other infectious process, whether that could be a pneumonia, where you would have some issues breathing, an infection in the lungs. And what we've also found is that it also complicates any conditions that you may have had prior to. So in the event that you would have been suffering from diabetes, now it may be difficult to get your sugar under control. If you were someone who was hypertensive, now it may be different for you to regulate your pressures. And so it not only increases the chances of you developing another infection, but also makes it more difficult for a condition that you had previously to be put under control.
Dr. Bain, we're going to take a break and come back. I've got quite a few more questions, but we invite the audience to stay with us. We'll be back with more On the Record right after this.
Welcome to On the Record. Looking for more On the Record? If you miss our Thursday showing at 8 p.m., join us for the re-airing on Friday mornings at 10, and then again each Sunday night at 8:30. or go to our YouTube channel and catch up on all of our past episodes. And then like our Facebook and Instagram pages for a preview of upcoming shows and get a chance to ask your questions. Just look for On the Record.
Welcome back. You're watching On the Record. Tonight, our topic is managing COVID. My guest for this segment, Dr. Charlo Bain, is responsible for conducting testing for those who are unable to leave their homes and provide critical care while they are critically ill. Dr. Bain, we really were getting into the sort of the nuts and bolts of the symptoms that people are, experience throughout this entire COVID dilemma. Is it harder in providing care for patients that are at home in isolation as compared to those who are hospitalized?
It's an interesting question. What we've found is that individuals, well, there are several barriers. Let me start off there, that we would have to get through. What we find is that there are some persons who are happy to actually be treated at home, and this is for symptoms that we can resolve, whether or not it's breaking a fever or providing education on being hydrated again or getting some medication for pain. However, once we realize that management needs to be stepped up, then we realize that the person has to be transported to a medical facility, and then we run into the barrier of persons who, because of the current climate, are fearful of going into a medical facility. We also run into the issue of resources, because as much as we would like to be able to arm everyone with their own medication, it's not feasible to do so. And so what we'd have to do at that point in time is to identify who can source something for you. And then outside of that, we also run into a barrier with financial resources. Some individuals actually do require the assistance, but cannot identify someone who can assist them in getting any medication for any symptomatic relief. Either they may be here because they recently came over vacation and have to unfortunately quarantine. And so because of that, they're unable to ask anyone for help because they don't know anyone. And so in situations like that, we can find difficulty treating and actually getting the medication to them and advising them on how best that they can get the medication, opposed to if we are at one central location in the hospital where we have a pharmacy available and we can simply bring the medication to them.
Does that then involve a bit of social work now? Because you've got patients who are in need of care, who are in need of things. Does that sort of cross the line over into what you do, which is, you're to treat people for their medical conditions, but if they can't get the medication, or if they can't get out, or they can't get someone to help, does that now, cross over into providing them with social assistance?
It does, and we definitely rely on social services because we understand it's definitely a team effort. There's only so much that the mobile unit can provide. At the most, we can make sure that we have adequate referral to a facility that actually can give them the medical care that we can at that time. And so also with that understanding, we realize that social services plays a role because there are some things that we simply cannot facilitate, that they have the resources to actually make happen. And so once you have all of these different units working in tandem, we're hoping to actually combat it, but we're running into difficulties, like I mentioned before, because each case is different. And where someone may be considered a quote unquote quick fix, some cases are very complex, and their resolution may take a little longer than we would like.
Now, I want to talk now about recovery process. We all have really been focused up to this point in many ways on the testing, even the incubation period. But let's talk about the recovery period, and what's the standard recovery period, and when does the clock begin on your recovery?
Okay, so from the time we have an objective result, when I say an objective result, once we know that your test is positive, is when the clock starts ticking, ideally. However, because of the way the test is performed, it cannot say at what point in time you contracted the virus. The test simply says that it's present at that time, is actually able to be detectable. And so from there, we have an algorithm that we follow to say that this person can be recovered, and it has several contributing factors as it relates to their occupation, as it relates to their risk level, whether or not they were medium, low, or high risk, as well as any external contributing factors. And so once we take all that into account, from the point of gaining a positive result, the usual time period is at least 10 days with our current protocol that we're following, because what we've realized is that at this time we need to have both a test and non-test based criteria in order to discharge or recover a person. And so as it relates to the non-test based criteria for individuals who tested positive and they have remained in isolation for at least 10 days and have been asymptomatic for at least 3 of those 10 days, we are able to grant those individuals clearance. Now, for other individuals who are employed in a healthcare setting, those individuals would require an objective result, i.e. a negative COVID test, prior to returning to work, plus an additional test. Reason being is because the literature has shown that even if you had an initial negative result, that within 24 hours, it's possible that the viral load could mount again and that you could test positive. And so that second negative result is to ensure that those individuals who are actually bringing care to the general population make sure that their risk is as minimal as possible.
Now, does that standard 10 days where you are released, does that coincide with your level of contagion? Because that, of course, is the big concern. At the end of those 10 days, should you be, or has the research shown that you are no longer contagious?
Our understanding of the literature now, and of course everything is case by case because there are some individuals who are infected who have no comorbidities, there are other individuals who have several on board. And so the understanding is that while you're asymptomatic, your risk of shedding the virus is low at that point in time. Simply being asymptomatic and possibly only shedding through talk, opposed to having an active cough or an active sneeze, puts you in 2 different categories as to how quickly you could possibly transfer the virus. Also, we also have to take into account what your risk of exposure was at the time when you believe you contracted the virus. Is it that you had on any protective equipment? Is it that you had on a face mask? Were you talking without it? Is it that you were actually doing a procedure opposed to somebody that wasn't in the room? And so when you take all those things into consideration, yes, contagion does play a role, but it's only one portion of it that it contributes to the decision-making process.
Well, I guess what I'm trying to ask and trying to understand to make sure that we're clear on this is if health officials say to me that at the end of the 10 days and I'm asymptomatic, that I have been, released from quarantine, am I able to move about normally without putting others at risk at that point?
Okay, so as it relates to that, prior to actually getting your medical clearance, you would need to have what we call a risk assessment done. With a risk assessment, an individual will be properly identified, whether their medical status as it relates to their comorbidities as well as the symptoms that they may or may have had in quarantine is assessed, if those initial symptoms have worsened, if any new symptoms have developed. Also taking into account whether or not the person was honest with their quarantine as it relates to any community involvement, as well as indicating if the persons in the home, if there are any, if they recently became symptomatic, and also if their symptoms have since resolved. And so following the end of that assessment is when and if all of those the answers to the questions on the risk assessments are favorable, only then is the person gain medical clearance. And so the understanding is that if it is found that at the point of 10 days when the risk assessment is done, that the person is still symptomatic, that the person will not be released at that point in time because they're still considered infectious and actively shedding. If it is where the person is identified to have a comorbidity then, and the person says that, okay, several of their symptoms are still present, then what we would opt is to give them additional some more days in order to clear. 10 days if you are asymptomatic, doesn't simply mean that you get the clearance. The risk assessment is what actually gets you that green light.
So one of the misconceptions, I think, is that once you've, once you've caught corona, once you have come through this now, you're good. You can go out in the community and you're fine. You should be able to move around comfortably and not worry about catching it again. But I did preface all of this by saying it's a misconception. I want you to address that again, please, because some people feel that once you've come through all of this, you are okay. You are no longer under threat.
So the understanding was once you, and this is an ongoing process as everyone in the medical community is being more informed about the virus and how it works. The initial thoughts were that once you have been infected and you develop antibodies, that for a period of somewhere up to 6 months, that you won't necessarily be concerned with reinfection. However, what we found, and there was a case that not necessarily in the Bahamas but elsewhere, showing that somebody who initially tested positive had then tested positive after some time, after several months of being recovered, tested positive again. And so it then opens up the idea that as it happens at another geographical location, it can happen on our shores as well. And so what we also took into account is the fact that the virus, from our understanding, can involve mutations, and with that, different strains can also be developed. And so whereas you could have been infected with one particular strain, here it is now that later down the line, several months later, there's a new strain that's now being introduced to you that you don't have antibodies for, and so now you become infected again. And so that's why when people start speaking of the new normal, you understand that what we're doing now is actually progressing to be commonplace, because at any point in time, we know that the risk of infection is going to be there, but it doesn't mean that we still can't continue on with what we've already been taught as it relates to proper hygiene so that we keep ourselves safe.
I know that following, I know that following your recovery and release, there are times that, or you will develop, as a result of having contracted COVID, you would develop some other issues. People complain of, pressure within their lungs or other things that they have noticed post COVID. What are some of the things that you all are noticing, or the medical community is noticing, that people are developing afterwards? What kinds of health concerns, and how should they be addressed? I mean, once you've come through this, should you actually then go to your doctor or to a physician and get a full medical assessment?
Okay, so I'll try and answer the first portion first as it relates to what we've been seeing that seems to persist. So some individuals come in complaining of fatigue, and what we found is that that symptom of fatigue can be ongoing several weeks after one has been recovered. We understand too that most of the times that fatigue is caused by any exertion, and because the virus primarily affects the lungs, it's going to take some time until that lung tissue, because of the inflammation and the entire infectious process, gets back to 100%. So that means that those individuals need to be given the education that yes, you're recovered at this point in time, but you're not going to really feel 100%, possibly until a few weeks later. But just because you're not back to having your full energy level does not mean that you need to be concerned now in terms of not returning to work or not being able to continue on with the day-to-day processes in terms of shopping and everything else. I think the other portion of your question was related to.
Yeah, should you go and get a full assessment when all of this is over? Should you, I've already spoken to my doctor about going in to have an assessment, but I'm wondering, should people go and get a full medical assessment?
Right. So what we're finding is that because now of this infection, people are actually getting checked out for the first time in a while. You have some individuals who have been prescribed medication, whether it be for their chronic condition or not, and have chosen when to take them, have not been to see their healthcare provider in a while to see whether or not that medication actually needs to be changed or modified in any way. And so when we speak to them, we said, okay, well, what are you taking? The expectations that you'll be able to say, okay, well, this was recently changed or because of this, but they honestly can't say because the last time they actually spoke to their doctor was in a while. And so we are encouraged them following their recovery to see how early they can schedule another follow-up. to ensure that their chronic conditions are also taken care of. In addition, if it is there's someone on the other end of the spectrum who realize that, hey, I never took a physical before, but now because of this I want to get checked out, then yes, we also encourage that as well, because it's also important to have some baseline and also establish having a family care provider for you, so that going forward, you know that in a situation like this, you already identified a contact person should something go wrong health-wise.
Dr. Bain, thank you very much. I think with your last response, we probably opened up um, another can of worms just about the general, how seriously we take our health in general, and the fact that we don't always go to see our physicians and do the things that we do in good times. And so hopefully this is an eye opener to everyone to constantly keep up with their checkups, et cetera, and make sure that you see your physician on a regular basis. Thank you so very much. That's going to do it for this portion of the interview. But we do want to thank you for the work that you're doing. Be encouraged. We certainly could not continue to grapple with this virus and do the things that we are doing without the work that you and your colleagues are doing. So thank you very much. Continue to do the great work that you are doing. And again, thank you for coming on the show and being our guest.
Thank you so much. Thank you. Take care.
Hello and welcome to On the Record, and the balanced, true, and open debate you've been looking for.
Watching On the Record. This is your host, Jerome Sawyer. Tonight, we're looking at managing COVID. Now, when a positive case is identified, the Ministry of Health is notified immediately of the patient's contact information to begin contact tracing. It's imperative that contacts of a COVID patient know that they may have been exposed and are being monitored for any signs of symptoms. We continue our conversation in this segment with registered nurse Joyann Cartwright. Nurse Cartwright, thank you for agreeing to be our guest here on the record tonight. So, we've all heard about this thing called contact tracing. We've done tons of shows on it and attempted to show and explain to people how it all works. But let's talk about when and how this process begins once there is a positive test, or how should it begin?
Okay, so how it begins is once someone tests positive for COVID-19, like you said, the Ministry of Health is informed, and that is, as I said, the surveillance unit. So we start our process by contacting that case. Once that case is contacted, we ask them for anyone they would have been in contact with, close contact, and based on the names that they give us, we make a record of that, and we reach out to those people to inform them that they would have been exposed to a positive case and advise from there.
Okay, so what is the general time frame you would say from the point that you receive the information that a person is positive to the point when they are contacted? Because I've heard people say of the delay that they've experienced getting a contact. So what's the time frame that you all go for?
Typically, we like to do that as soon as possible. However, as you would know and the public would know, it varies now because based on the influx of patients and the amount of people that are testing positive now, there has been some delay. So it varies from person to person at this time, but typically we like to get in contact with that person immediately. So I would say within 24 hours of finding out about that positive case.
Now, I do know some instances where people say that they were not contacted or had to reach out on their own and get a contact with someone at the ministry so that they can begin the tracing. But if you find yourself having a positive test and you've not gotten a contact or not gotten a call from the ministry, what should you do?
If you haven't gotten a call from the ministry as after testing positive for COVID, you should isolate. You know your status. A lot of people, if we get to them late, they tell us that they are aware of their status and they are to remain at home and isolate at that time so as to protect the public until we can get around to them. That's the most responsible thing to do. Also, there are numbers that they can reach out to for further advisement, COVID hotline, as well as surveillance numbers that have been released to the public.
Now, um, in the case of your contacts, if you find yourself positive, uh, should you begin to contact the individuals that you have had contact with and say, listen, I have this positive test. I just need you to know.
Yes, I would advise that people do that. It's best to reach out to the people you would have been around most frequently and most close to just let them know that, hey, I have this positive test. I want you to know so that in the event that you do develop symptoms, you know how to move forward based on whether they should isolate or whether they should get tested as well. So yes, I would advise that people that test positive inform their friends, family, coworkers, anyone they may have put at risk.
And what's the time frame of contact? Is it people I've had contact with in the last 24 hours, 48 hours, 72 hours? What's the time frame of contact?
With our patients, like let's say someone is symptomatic, we tend to trace all the way back 14 days, and those that would have developed symptoms, we ask them to think 2 days prior to developing symptoms, who they would have been around, because you're actually infectious 2 days prior to developing your first symptoms. So 14 days, 14 to 16 days, I would say, if you're symptomatic.
Okay, so anyone you would have had contact, just so that I'm clear on the explanation. So if I've developed symptoms, or if I have symptoms, I need to find people that I would have had contact with.
Close contact.
Pardon?
Close contact. So that's anything 15 minutes or more without the use of a mask and without social distancing in the past 14 or so days.
Okay, so that's very important. So anyone I would have had contact with for 15 minutes or more, without a mask.
Correct.
Now they would be the individuals who are considered at risk.
Right, and without social distancing, because you should be 3 to 6 feet away from people. So if you have done any of those, you weren't wearing a mask, you were with them for an extended period of 15 minutes or more, and without social distancing.
Okay, now what about, let's say I want to use the scenario of a coworker or people you work with. Let's say I've developed, I have a positive case. I would have been to work in the past few days, or I would have been around people, but we all wore masks, we all kept our distance. What's the level then of exposure?
With those cases, we also take into consideration the workspace and how small a place would be, and how much equipment you may have to share, like pens, keyboards, phones, stuff like that. So in cases like that, we have to assess the workplace in itself. But if the person can um, clarify and state that, yes, I haven't been around this person without a mask on, and we just let those people go. They can be aware of it, but it's not that we would hold them in quarantine. They won't be mandated to be in quarantine.
Okay, all right. Now, in the case of, when somebody, once you tested positive, once you said to individuals, listen, I have tested positive, but let's say they are not within that level of exposure. As the person who's been in contact, what should you be looking out for? If my friend is tested positive, what types of things should I be on the lookout for, and for how long?
Okay, so I would advise that you look out for the most common symptoms, which would be fever, dry cough, shortness of breath, and most recently, people have definitely been experiencing a loss of taste and smell. Those symptoms I would say to be most aware of. There are other symptoms like headache, muscle ache, fatigue, stuffiness, vomiting, and diarrhea. Those are also indicated. So I would advise that those people be on the lookout for those symptoms. And like I said, the incubation period would be anything 2 to 14 days. So any time frame post exposure, 2 to 14 days, look out for those symptoms.
Okay. And then once individuals have been diagnosed, um, is it absolute? And by diagnosed, let's say I've lost my sense of taste, lost my sense of smell, and I know, you all know, based on the assessment, that that person is positive. Is it absolutely necessary to take a test? And there's a reason why I'm asking that question.
We don't advise testing right away simply because there is a window in which symptoms can develop. We have sometimes some instances where people can test too soon and you can get a negative, but you're not allowing time for the virus to actually present itself. And in 2 or so days, you can actually pop up with symptoms and have to be retested, and now you're positive. So we don't advise testing just because you were exposed. No.
Hmm. And let's say, I just want to use a scenario. Let's say I've lost my sense of taste, lost my sense of smell. I call in to the hotline, or I call some of the Ministry of Health and say, listen, this has happened to me. It's pretty clear that I'm positive. Should I still get tested, or should I just begin
Okay,
my quarantining?
let me see if I'm understanding your question correctly. You're asking, as someone who has been exposed, you've now developed loss of taste and smell, and
Yes.
you're asking
Uh-huh.
you should get tested.
Yes.
Yes, you should seek getting tested. You can also call into the hotline and seek their advice, let them know what's going on with you and what has developed and the history of exposure, and they will be able to say, okay, well, yes, you should get tested or you should not get tested. But with loss of taste and smell, that's a hallmark symptom. So most likely, yes, we will advise testing in that situation.
Hmm. Hmm. But do you, and I can tell you, some people have just opted, to not get tested and say, okay, I'm going to just isolate for 14 days. I'm just going to, or I'm going to quarantine for 14 days. Do you advise against that?
No, I don't advise against it. That's good to isolate. However, if you develop any symptoms and they worsen or persist, I would advise getting tested at some point. But isolation is always the best thing to do, and it's the most responsible thing to do for the safety of the public.
Okay. Now, once I want to go back now to tracing. Once you have been given the name of a positive person and their contacts, what types of information do you now seek to get from these individuals?
Once we contact a positive case, we get basic demographics, which will be your name. We also ask for their mother's name. This is important in tracking down medical records if need be. Sometimes you have to refer to the mother's name because that's how some people are still stored in the medical system under their mother's maiden name. We also ask for NIV numbers just so that we can be sure that this is the right John Doe that we have. Because some names are common, you can have hundreds of John Smiths, so you want to be able to differentiate. We ask for the number of bedrooms and bathrooms in the home. We ask for the number of people in the home. We find out your social status, any needs you may have, whether it be psychological, financial, medical, anything of that nature. And that's the gist of it.
Hmm.
Yeah.
Well, what I found interesting is in my experience when I got the call, they did ask me if I wanted someone to pray with me, and I thought that was interesting. Do you have people who deal specifically with those who need prayers or who request prayers?
Yes, we refer to different agencies. So if they do request prayers, there are people that we can refer to or liaise with to just give them that kind of counseling because a lot of people do actually say yes, they would like someone to pray for them. So yes, we assist with
Mhm.
that.
And what is the frequency of your calls to those who are positive? Do you call every day, every other day? How does it work?
Ideally, we would like to call every day to check in daily. However, given the numbers recently and the number of staff versus patients, it's not feasible. So I touch bases, and my colleagues as well, we touch bases every other day at this point, sometimes every 2 days, 3 days. Also,
Hmm.
I extend my services via WhatsApp so that my clients can actually message me on WhatsApp and check in with me, voice any questions or concerns. And that seems to help a bit more because, it's easier for them to reach out to me than for me to reach out to all of them, if that makes sense.
There are a number of private facilities that are now testing. I mean, when we started out, the Ministry of Health, the South Beach Clinic was providing the majority of the testing, and Doctors Hospital then came on stream. But there are a number of private facilities that are now offering testing. How is that all coordinated with you in contact tracing? What's the I guess the process in getting those names to you of those who have tested positive?
The private labs have now started emailing us here at the surveillance unit. So once they test their clients and they get those results, they email the information to us so that we can now take over with contact tracing or case tracing.
Okay, Ms. Cartwright, we're going to take a final break in the show. I've got a couple more questions for you, so please stay with us. We're inviting our audience to stay with us as well. You're watching On the Record. We're going to be back right after this.
So the project really pays itself. They
Correct.
set up
At the conference, more the school.
As a journalist, I always have to focus on the facts, and sometimes that means going to investigate for myself. On the Record, Thursdays at 8 p.m. right here on RTV.
Welcome back to On the Record. This is our final segment tonight. We are talking about managing COVID. Surveillance nurse Joyann Cartwright continues to be my guest for this segment. A lot of times people aren't compliant. People don't want to abide by the rules. They don't want to be honest. Nurse Cartwright, have you all found that you've had a lot of difficulties with people either not doing what they're supposed to be doing or not giving correct information?
Yes, we have had a lot of problems with people not wanting to comply and give correct information. And I think that, it just stems from lack of knowledge of the disease. And I think it's a lot of fear involved. So many times we call people and they react very negatively and they refuse to be a part of contact tracing. They refuse to list contacts. They refuse to be called. So yes, big problem.
Wait, people refuse to give you information, and how do you refuse to be a part of contact tracing? If you are at risk or if something has happened, how do you refuse that?
Unfortunately, sometimes these things are subjective. We can only go based off of what people say and the information they allow us to have. So once they state that they no longer want to partake in the questions, once they state that they no longer want to be a part of the call or participate in contact tracing, then yes, we have to actually just terminate the call. And in some cases, we go above and beyond. We go to the higher powers that be to maybe seek the information for those people. But in many instances, you have some people that simply are lost, but we call lost to follow up.
And are these people positive?
Yes, they are. Yes, they are positive. You have positive patients that refuse, some, not the majority, but some. And you have some contacts who refuse to be followed up as well.
Pardon me for being surprised, but I just don't understand. And I guess I'm asking you a question you can't even answer, but I mean, well, let's go a little further. What risk do they pose when they refuse to be a part of the process or simply refuse to give any information? What kind of risks are they posing?
Well, as you know, COVID-19 is a public issue and it's public safety that's at risk now. So when people refuse to comply, when they refuse to give us the information, when they refuse for us to follow up with them, they now pose a threat to the public, and they cannot be followed. We can't speak for them, and now they can infect other people. And in infecting other people, the numbers go up, which puts us in a state of emergency. So yeah.
I mean, and I guess sometimes it's really hard to tell, but do you think, and from the information that you've been able to look at and sort of, chart, um, is that a major problem for us? The fact that people are not sharing information or not being honest and know they may be infected and continue to carry on life as normal?
I wouldn't say it's a major concern because, like I said, the majority of the public are complying with us, thank God. But for those few, it's a concern, yes. And in situations like that, we have to get the police involved. We have to speak to those lawful authorities so that they can help us. So this is a huge team. It's not just surveillance unit. It's not just doctors. It's not just nurses. We have police on board, we have defense force officers, everyone that we may need to call on to get these people to comply.
And just so that people are clear, if you are positive, you are duty bound to do some things, correct? By law?
Yes, you are required to stay at home and isolate. You are not to interact with the public because it is a public threat. It is a problem for public safety.
It just baffles me that people would
It
not.
baffles me as well.
I
It
just,
baffles me as well. But like I said, I think the public really needs to read more. Don't just go based off of what I say. You don't have to listen to me as the nurse. You don't have to listen to the doctor, but you could read for yourself. You could look these things up and lay a foundation of knowledge for yourself and your family and your friends, just so that we can move on more as a country, so that we can get it together, because we're trying to grab hold of it and get a control of what's happening, but it really, really, really has to be everyone involved. The community has to help us. We can't do it alone. We really can't.
from the time that you have been involved and watching all of this, even in the second surge, are things getting better or are they getting worse?
I would say definitely got better. We had a huge surge at one point, and I mean, it was just hundreds of cases a day, as you know. So now we have, I think, regained control of the situation, and it has slowed a bit. But that's not to say we must let our guard down and relax now as a country. We should ramp up more and be more on guard and be more aware of what we're doing. And here at the surveillance unit, we are working tirelessly and we continue to do so. So whether it's getting better or worse, we're gonna be working hard.
Is there a difference in dealing with the family island patients as opposed to those of us in New Providence? And, I always say, I think, New Providence people, we cut from a different cloth, and that's not a compliment. But is there a difference in dealing with the family islanders versus those of us here in New Providence?
Well, just how we are a certain way here in New Providence, every island is different. Every island has their own culture, which poses a different challenge. So I can't say that they are easier. The family islands are very, I don't even know how to describe it. They're very particular about who comes into the country and who tells them what to do and all that stuff. But for the most part, they're very compliant. And once they understand what you're doing and once they trust you, it's fine.
I know that you all have a volunteer program as well where people are able to complete an online course to be part of the volunteer team. How is that going? How does that work? And if people want to become a part of that, can they still participate?
Yes, we're still welcoming volunteers. The more help, the better. It's going very well. Without these volunteers, we could not have gained control of the situation the way that we did. So a huge thank you to all the people that have volunteered and sacrificed their time and their safety to be here with us and just fight this battle.
Do you have to have any medical training to become a volunteer?
No, you don't have to have any medical training to my knowledge, no.
Okay. And how does one become a volunteer should they want to participate?
To be honest with you, Jerome, I'm not too clear on that.
Well, they'll Google it. We'll find
Yeah,
out
yeah.
information out there. And that's fine. Once it does exist, or they can call into the hotline, I'm sure.
Yes,
And
they can definitely call in and inquire, yes.
okay, great. Now, from your own individual perspective, you're a frontline worker, you're out there, you've been involved with this. What is it like for you mentally? What kind of strain has it placed on you having to deal with this? And also, do you feel a sense of sort of obligation in helping country?
I definitely feel a sense of obligation in helping the country. As a nurse, you really do sign up to help and you sign up to heal and prevent illness. So I do feel a sense of obligation in that regard. Mentally, it's very taxing. I don't think people take into consideration that us nurses here, we are human, despite what you may think, and we deal with different personalities nonstop every day. We have hundreds and hundreds of people, thousands of people we're trying to reach out to, and it's just different personalities all day, every day. You have some people that are very upset and angry, and they just want nothing to do with you. You have some people that are depressed and sad, and they just burst into tears on the phone. You have some people that are nonchalant. You have some people that are just confused, and you have to learn and be able to cope with all those different personalities. And of course, now as a healthcare professional, they're leaning on you to give that support and guide them. So it's not just making a call, it's being there for that person with whatever they're feeling at that moment, and being able to know that when you hang up from them, you gave them some sense of security and comfort so that they know that they will be okay and we'll get them through this. But you take all of that home at the end of the day. Some people who can't afford to stay home for 14 days because they're the only one working and they have to feed their 5 children. And some people that just have no one to lean on, no one can come and bring them groceries. People who live paycheck to paycheck and already out of a job, and now they have to stay at home and just hope by chance someone just helps them out. So you take all of that home at the end of the day.
Ms. Cartwright, I mean, I don't think we could have ended on a better note because I think out of everything, that gave us the greatest glimpse into the reality of this that you all are dealing with, and that so many hundreds, and I would say even thousands, are dealing with it as well. And so we thank you for your work. We applaud you for everything that you are doing. Thank you, thank you. Keep up the good work. We appreciate you, and those like you, the many nurses and doctors and volunteers who are out there every day helping us in this fight. So thank you very much, and thank you for being on the record.
Thank you too, Jerome. And I just want to plead with the public, please just bear with us and comply with us. It's so much different factors that go into contact and case tracing. And I know a lot of people may be frustrated with the timing that we're getting to them, but really it's different institutions involved, and the surveillance unit is dependent on when we receive information from these institutions. We can only act once we get that information. And also, if you're getting tested, please put a valid phone number on the form for us so that we can reach you in a timely manner.
Wow, the things like that would seem almost elementary in a situation like this, but these are the realities of the situations that we deal with. Again, thank you very much. That's going to do it for this edition of On the Record. As always, it's been our pleasure. Thank you so much for watching. Remember, please wear your mask in public, wash your hands, sanitize, and keep your distance. It's the only way that we can effectively fight this deadly virus. Again, thanks for watching. That's going to do it for all of us. On behalf of the technical and production teams, thanks for watching. We'll see you next time, same place, same time, right here on The Record.